If there is no question, then we proceed to next lecture. I would like to invite Dr. Anu Goswami for the next lecture. Topic is, can we prevent and reverse type 2 diabetes naturally? Dr. Anu Goswami is consultant gynecologist, having teaching experience of more than 14 years, member of FOGSI, several publications in national and international journal, and she is running many fitness programs for the lifestyle diseases, which is very important in the case of diabetes, especially the reversal of diabetes. Dr. Anu Goswami, please.
Very good afternoon, chairpersons, and very good afternoon to all in the audience. What is a gynecologist doing in a medical forum? But yes, I'm here to share some of the things which I have experienced, because I am very, very excited about lifestyle modification as treating the root cause of problems. Because somewhere in our traditional medicine, probably we are forgetting that we have to always go back to the root cause. For example, I'll just give you an example. We are all treating diabetes. I will not, go into it because you people have much more experience than me in treating diabetes. But just to think about it, what do we normally do? When a patient comes to us with high blood sugar, we start treating them for that high blood sugar. But is high blood sugar the cause? It is insulin resistance which is the cause, right? So unless we actually address insulin resistance and we start treating only the blood sugar as a problem, it's not actually going to make any remission chance possible in that person. Am I right? It's almost like treating fever due to some infection or say pneumonia, and you don't give antibiotic and you start with paracetamol treating the fever. Will that help? And sometimes our approach in diabetes and many other chronic diseases has become like that, where we are treating only the finding or the symptom, right? So I'll be talking about something which is been my experience, but yes, we all know how bad diabetes is. We know what is the extent of problem. I will not go into all this, but I just want to share one thing with you, that in US they have pre-diabetes. They had checked the prevalence. They found 1 out of every 3 adults. Unfortunately, I think India, we don't test it that much so that we know the real incidence. Or prevalence. So we get to know something like 14% is the prevalence of pre-diabetes in India. But actually, if US is having almost a 40% prevalence, I think we also would be somewhere near that, considering that we are the diabetes capital of the world, right? So I'll be mainly talking about reversing type 2 diabetes, because that is where we will be focusing. So some level of insulin resistance is there in all pre-diabetics and in type 2 diabetics. Some degree can occur even in type 1 diabetics. Hyperinsulinemia is associated with all these conditions like triglycerides, getting increased high blood pressure, etc. If you look at this, insulin is the root cause for type 2 diabetes, PCOS, polycystic ovarian syndrome, and atherosclerosis, dyslipidemia, hypertension, and a lot of things like obesity, inactivity, genetics, aging, medications, and disorders are actually kind of implicated in that. So let's talk about how healthy we all are as doctors. Okay, so if we look at it, doctors were found to be at higher risk for cardiovascular disease, even as compared to nurses who work in the same level of stress probably. And prevalence of diabetes was found to be 25.4% among doctors. And I think I'm talking only about the diagnosed diabetics. I'm probably not talking about the pre-diabetics. I'm not talking about the people who actually have insulin resistance. But your HbA1c is normal in spite of that, because your insulin is really working overtime, your pancreas are working overtime, and they're maintaining that blood sugar somewhere there, right? The reason why professionals are more at risk could be because of our sedentary lifestyle. We don't get time to exercise, irregular eating habits, we sometimes have whatever is available, cravings, habits, sometimes which are detrimental. Stress to hai hai, it's a taken. Stress will be there, inadequate sleep will be there as part of our profession. Right, especially with gynecologists, it is much more. Sometimes lack of information on what to eat and dietary deficiencies of essential nutrients. Now this is what is internal starvation of a diabetic look like. Okay, neither he feels he is starved, nor does anybody looking at him feel that he is starved. But actually he is, right? And we will, when we write a prescription, we'll often write towards the end, after 1, 2, 3 drugs, we will write, reduce weight. Anybody here tried reducing weight? Is it easy? Does that weighing scale move easily? No. Yeah, some people are raising hands. Wow. Right? So, but when we talk about, yes, insulin resistance as the basic issue, and then we can do, but weight loss methods, what are the things you could have tried? Some people start by eating less. They think, okay, I have diabetes now, I have to stop eating. I have to eat less, although craving is much more. Starvation will again put them, it will slow down their metabolism. Once the metabolism slows down, obviously, they are not going to lose further. And that's where the story stops. You lose 2, 3 kgs, 4 kgs, and then it just stops over there with most of the methods. Exercising more. Now, if you can follow an exercise and you can always follow it, it is going to be useful for you. So say you're walking 10,000 steps every day and you're able to do it every day, it's great. But 1st of January will come, lot of people will take gym memberships, lot of people will hire personal trainers, giving responsibility to somebody else for your exercise. That doesn't work unless we take responsibility of our health and we start doing it ourselves, right? Most of the gym memberships, you know how they are, but doesn't go to that gym after some time, right? So hunger modifying drugs, I'll not go into the drug part, yes. Controlling calories, sometimes people are getting so weak. Fasting, intermittent fasting is really caught up nowadays. You find so many studies and you find Dr. Jason Fung talking a lot about it. Excellent talks he gives, but practically speaking, for a diabetic to go on fasting and intermittent fasting, he will land up with, lot of hypoglycemic attacks sometimes, because that dose will need to be regulated, and practically his cravings may not let him, stop eating. Like just now, there was a discussion about GERD, so for gastroesophageal reflux disease, it's a great idea to not to eat after 7:30 p.m. in the night. Just try it, it works, right? And then give a nice 12 to 14 hours gap before you eat the first thing in the morning. So that does work, but then practically it becomes sometimes pretty difficult to follow, so yes. And just now Dr. Ashok spoke so much about stomach surgery, but how many, sorry sir, but how many of us would like to have that knife go on us? And how many patients do you think are going to like that? And for how long will they have that effect with bariatric surgery? And their life is so limited. They have so many nutrient deficiencies. So why not treat things at the basic cause, and why not think about simpler methods to treat big problems? I'm sure when you go treat things at root cause, that is what is there, right? So solution is simple lifestyle changes. Walking 10,000 steps every day, count the steps. Like somebody said, measure your blood sugar, please count your steps also, right? There are devices available, you can easily do it. Check what you eat. Eat early in the evening. Take required protein intake. Take water intake properly, 3 liters of water. Most of the people don't have it. If you check yourself, you will also find that most of the people don't have it. Then make sure you're taking all micronutrients and all vitamins and all essential amino acids, right? Exercise, we spoke about exercise, yes, it reversed insulin resistance. See, some of the things may be overlapping because, yes, naturally the methods are overlapping, so similar things are there. But do we know that it can actually change things at genetic level? So can we do a minimal exercise every day and change our better off? We can make that change for them, right? So this is American Diabetes Association also accepted finally that nutrition therapy for adults with pre-diabetes or diabetes is possible. Although earlier it was that it is not possible and it is a progressive disorder. Yes, like rightly Dr. Ashok also just pointed out. Yes, it is reversible, and yes, remission can be achieved, right? So this is insights from a general practice. This was an article published for 6 years. They did HbA1c level in pre-diabetics and diabetics. and they gave them a low carbohydrate diet, and they found that diabetes remission was 46% in type 2 diabetes, and pre-diabetics 93%. Is it not simple if you know what to choose in your food plate? I'll be coming to the practical part of it also. Yeah, quickly going through this. So low carbohydrate diet is a very valid option for treatment of both metabolic syndrome and insulin resistance, and these are the studies. Let me talk a little bit about leaky gut. So gut is now second brain for us, right? And gut is of course considered responsible for a lot of issues, all autoimmune problems for which we say etopathology not known, and a lot of other things, right? And nutrient malabsorption of course is there. So even type 1 diabetes is considered, it's due to some amount of leaky gut and gluten sensitivity. So leaky gut is simply, there's a lot of literature on probiotic, prebiotic and symbiotic administration for leaky gut. Okay, probiotics is your simple curd at home, use it. Yeah. Prebiotics are soluble fibers. Soluble fibers are there in a lot of things, I'll be coming to that, so I'm not going now. And of course, they're very effective for type 2 diabetes therapy if you use them. Then of course there are a lot of studies which say L-glutamine, which has been helpful for tightening the lining and all. But let me come to simple things like probiotics and prebiotics. So probiotics, as I said, it's available in your curd, it's there as other supplements also. Prebiotics is actually inulin oligosaccharides. So these are actually food for your gut bacteria because they are going to pass through your intestines or the whole GIT. And once they reach the large intestine, your good bacteria will be able to utilize them for food. If we are taking only junk and we are taking very little of soluble fiber, are actually good bacteria which are going to help us with the toxin absorption. They're going to make sure they fight for us over there at that level. They don't get any food, right? And whenever we talk about leaky gut and whenever we talk about using prebiotics, do remember it's going to take about 2 years for your change diet to work on that person. It will start showing results, but it will work, it will show results, proper results after that. And who out of us is taking the recommended 25 to 38 grams of fiber per day? Men need 38, women need 25 at least, right? Soluble fiber examples are oat bran. Which oats do you use? Do you use rolled oats? Do you use steel cut oats? I'm talking about practical information, okay? Or are you using those ready to cook ones and feeling happy, yes, I made oats today or I had oats today? No need to feel happy, they are just as good as your maida which we've been criticizing for so long, right? So make sure that you take, you can include these food items which I have listed, try beans, peas, nuts, etc. They are very good with your inulin and they are very good with your soluble fiber, which of course is going to pass. This is, insoluble fiber is the one which is, going to make the bowel movement, good. So they are green leafy vegetables and fruit skins and all, but for diabetes, when we talk about, we are talking about soluble fiber as the main thing, right? So gluten. Now wheat has been a very, very, very major factor which is in a lot of discussion right now. And gluten, of course, it is a potential determinant in type 1 diabetes and even in type 2 diabetes, friends. If we can leave gluten for 3 months, try it on yourself. Before trying it on the world, try it in your own home. Leave wheat for 3 months. You will find such a remarkable difference in your life and you will find so many inflammatory problems getting over with that, right? Let me give you the alternative for wheat because you will say, I want to have my chapati. What will I do with without my chapati, right? So millets is the ancient staple. Sometimes we think wheat is our ancient staple. Our ancestors have been having wheat. No. They have been having millets, which were our staples, which are grown basically in India. 12.5 million tons we are growing here, right? So they are small seeds which are there, which are like simply known as ragi, bajra and jawar. So these are simple items which can really help. Now a lot of studies are there on this. You can check potential of millets for managing. They have found HbA1c had shown a significant reduction within 3 months of taking this diet. Does it make sense then to change? Before trying out drugs, can we try on the diet first and the exercise first, right? So this again was foxtail millet. You can make beautiful dosas with foxtail millet. I can share the recipes if anybody wants to after the talk is over. But it really helps. All these things help you to reduce your HbA1c. Legume consumption. The world is waking up to our superfoods, which were millets, and to legumes. You know, the world did not have all this. Western world did not have it, so you don't see that many studies over there. But legumes have a fantastic, because all the Mediterranean diet and all, they have a fantastic result. So they have seen that there was a significant difference in the new cases which occurred with diabetes. Okay, so my time is up. Huh? Okay, fast. So inositol. Inositol is one thing which can be again used as a dietary supplement also, which has been helpful for prevention and treatment. Vinegar supplementation. If you are having rice or wheat or have a carb diet and you are somewhere where you can't get access to anything else, can you put little lemon or lime squeeze kar dijiye uspe, put a little vinegar with it, take apple cider vinegar with it, that will help you to reduce the glycemic index of the meal. Right? Food order makes a lot of difference in the glycemic response of the food. So take proteins first, take salads after that, and then go for the carbs. See, these are simple practical tips. If we start giving to our patients, they will benefit from it, right? So then there are certain herbs. I will not go into the treatment part. We all know fenugreek seeds help. Then berberine tea has been known. This is a Chinese, traditional Chinese medicine which has been known to help. So they show, of course, very promising results, and they can be used. Fruits like jamun have been shown to have this thing. Micronutrient deficiency like chromium, selenium. If I ask you, did you have selenium today? Did you have chromium today? What will be the answer? Okay. So how will our patient take it? Getting fatty liver. It's easy to get fatty liver. Just give them short-term carbohydrate overfeeding. Weight might increase only by 2%, but 27% increase in liver fat and de novo lipogenesis in the liver. And NASH and of course fatty liver and these things are becoming important causes for cirrhosis today. Is it reversible? Yes, it is, with low carb diet, with intermittent fasting and with milk thistle. Foods which we need to stop. Okay, sugar, honey, jaggery, wheat products, white rice. Replace with dates, maybe stevia, millets and some other substitutes, right? Become an ingredient detective. Read the labels of what you're eating. 75 trillion cells of our, if they become happy, we are happy to. Snack to Fitness program is a program in which I am, really working with people and to minimize and defeat disease. And my goal is to make them drug-free. Today you might learn what medicine to give when this one fails, when this one fails. I'm trying to take them on the reverse path. Let me get rid of this medicine, then give this medicine and this medicine, right? So, yes, this is a person, these are real examples, who's lost 27 kgs weight and his HbA1c has come down from 6.7 to 5.1 without drugs. Okay, this is my journey. Okay, so only good thing is fat loss. I've reduced my HbA1c from 7.1 to 6.1, so whatever I'm talking about, I'm practically applying it. This lady has, come down from 6.5 to 6.2. She's been almost 3 months on the program. This one still has to get his HbA1c done, but it is reduced. He's lost 13 kg weight. And this diabetic, he's a diabetic for 24 years and he has he's beginning to reverse. His insulin, he's on insulin. It has come from 42 to 24 units. I see that as success. I see every drug going out of a prescription as a success for the treatment. Okay. So this is what I wanted to share with you, friends. I hope I have not bored you too much, but these are practical things which I have found very helpful, and I think if we as physicians, if we as treating doctors take these things into account, we can actually make a lot of difference in people's lives. So thank you so much for being a wonderful audience.
House is open for the discussion. Any comments?
Diabetes is preventable, no doubt. I am one of the eldest persons sitting here as Dr. Kalra, senior. Diabetes More than 55 years as doctor. That's good, I'm not happy. But I do regular exercise, 40 minutes in the morning, 30 minutes in the evening. And I play once in a while for 3 or 4 hours. And I eat everything. I take fruits, I take out. But mainly exercise, nothing else. No restriction. I want you to be active. So please do exercise, have positive thoughts, control yourself. No diabetes.
Okay, thank you, sir. That was very useful information for everybody. See, if you follow proper lifestyle, yes, you can prevent it. And if you, of course, you can reverse it also with lifestyle again.
I want to make one point.
Yes, sir.
Now, everything is, got plus and minuses. Now, it's very easy said than done. So, lifestyle modifications, very easy to say, but very difficult, the most difficult thing to follow. And we have a study, look ahead trial, 8 years almost, study. And in first year, there was a lot of weight reduction, A1C and lipids and blood pressure. Second year, it came down, like it increased. The effect was less. At the end of 4 years, there was no effect on weight. So what I want to say, that naturally when you reduce your weight by diet, there is a metabolic adaptation. Means your BMI also sets at a lower level when you do dieting, and there is a tendency to increase your intake in general for any kind of dieting you do. So at one point, it starts decreasing and then it becomes static. And after that, there is a chance of, coming back again. So the reversibility, I will not agree. Remission can be there, and even lifestyle modification is also a treatment. It is also a kind of treatment. So as long as one is continuing lifestyle modification, there's a remission. Once you stop, so what I want to say, there's no reversibility because pathogenic mechanism is there inside. The insulin deficiency beta cells, they will not become normal. So you're just controlling. So it is preventing and remission. So that's one point. And the second point, at some point of time in life, you might have to take medications. Like bariatric surgery is not just anatomical switch, it is a metabolic switch. There's an increase in incretin. So overall, you're absolutely right, but at the same time, we have to keep on endorsing and enforcing the patient to continue, and maybe some point of time you may need medication, along with lifestyle.
I agree with you, sir. And see, everything has a role. I'm talking about the first step, right? And like sir was saying that your weight tends to come back. Yes, it will, because your brain believes it has a set point for your weight. Supposing your set point is 70 kg. It believes, okay, I'm going to be 70 kg and it is going to work to bring you back to 70 kg every time you lose weight. So whatever modifications you follow, if you follow for 2 years, then it has been seen that your brain set point changes, right? So of course, diet, what is the problem in changing? What's the problem with leaving the wheat? What's the problem with leaving? Supposing it was not available in our world, we could have left it. It's as simple as that. So it's a change. Of course, that change needs help initially. It needs, somebody to motivate you, somebody to help you with it. But if you can form these changes, the time, I think, will tell whether we will make diabetes reversible or not. Because that is something which will come with time. Because we have started these interventions pretty recently, so it's difficult for us to comment, yes, that they can treat fully or they cannot. But I think they are simple options with no side effects. So why not give them a chance?
Taste matters a lot for the diabetic, even we can't alter the taste. So maybe in future we have to say the dietary plan according to the taste of the patient, not according to the grains and the